Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les personnes suivantes prendront la parole lors de la séance d'information de cet après-midi. Le Dr. Jennifer Russell, médecin hygiéniste en chef, et le Premier ministre du Nouveau-Brunswick, l'Honorable Blaine Higgs. Speaking at this afternoon's press conference will be the following individuals: Dr. Jennifer Russell, the Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Thank you, Bruce. Merci, Bruce. Good afternoon, everyone. Bonjour à toutes et à tous. Throughout the pandemic, we have sought to protect New Brunswickers through decisions grounded in science and based on the best advice and evidence available. Evidence and our data is now telling us that we have good reason to be concerned about the spread of COVID-19 in New Brunswick, particularly in Zone 1, which is the Moncton region. And we have good reason to be concerned about the course of the pandemic elsewhere in Canada and for those who regularly travel to and from regions outside the Atlantic bubble. En fonction des données probantes à notre disposition, j'ai recommandé au cabinet aujourd'hui de prendre de nouvelles mesures pour ralentir la propagation de la COVID-19 au Nouveau-Brunswick. Nous avons recommandé que la zone 1 retourne à la phase orange du plan de rétablissement en raison de l'augmentation du nombre de cas dans cette région. Le Premier ministre fournira de plus amples renseignements à cet égard plus tard. Nous recommandons également la mise en place de nouveaux protocoles liés aux tests de dépistage à l'intention des travailleurs qui quittent la bulle atlantique pour leur travail de façon à imposer des exigences d'isolement plus rigoureuses et à réduire le nombre de cas manqués qui ont contribué à la propagation de la COVID-19 dans la province. Partout autour de nous, tant au Canada qu'aux États-Unis, la pandémie s'aggrave. Des nombres records de cas sont signalés chaque jour au Québec, à l'Ontario, à Manitoba et en Alberta, dans le monde et aussi dans les États-Unis et nos voisins juste à côté en Maine. We have recommended that Zone 1 transition to the orange phase of recovery due to the increasing number of cases we are seeing in that area. We are also recommending new testing protocols for workers who travel outside the Atlantic bubble to ensure stricter self-isolation and reduce the number of missed cases, which has contributed to the spread of COVID-19 in our province. More Canadians are requiring hospital treatment, and the number of deaths in Canada attributed to COVID-19 is rising steadily. Our successes against the pandemic, gained through months of hard work and vigilance, can be lost very quickly. I just look across at Europe right now, and when we think about Italy in the first wave and how horrifying those photos were and the videos on social media, as well as places like New York City, we never wanted that to happen here in Canada, let alone New Brunswick, but now we are seeing it happening across the country with our counterparts in other provinces, and it is heartbreaking. And if we are not careful, we will find ourselves facing the same bleak outlook as most other jurisdictions in North America. Rapidly climbing caseloads, I mean exponentially climbing, more sickness and death, and significant interventions to stop the progress of this disease. Again, many places around the world are having to go into lockdown, including England and many parts of Europe. I think the only places in Europe that are doing well right now are Norway and Finland. But here in North America, again, I don't think there's anywhere in North America that isn't being touched in a very serious way other than the Atlantic bubble. So this is why we are acting now. We must stay ahead of the pandemic or it will overwhelm us as it has overwhelmed others. Aujourd'hui, il y a 4 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Les nouveaux cas sont les suivants. Il y a 3 dans la zone 1, 2 personnes âgées entre 20 et 29 ans. Une personne de moins de 19 ans. Il y a un nouveau cas dans la zone 2, la région de Saint-Jean, soit une personne âgée entre 30 et 39 ans. Il y a présentement 43 cas actifs dans la province, mais aucun d'entre eux n'est hospitalisé dès que notre rapport de 10 heures ce matin. Nous annonçons également qu'il y a une autre éclosion dans un établissement résidentiel pour adultes au Nouveau-Brunswick. Notre équipe provinciale de gestion rapide des éclosions est présentement sur place à la résidence Oasis à Dieppe, où un cas de COVID-19 a été confirmé. La recherche des contacts est en cours et de mesures sont prises pour limiter la propagation du virus parmi les autres résidents et membres du personnel de cet établissement. Today, there are 4 new cases of COVID-19 reported in New Brunswick. The new cases are as follows. There are 3 in Zone 1, 2 individuals aged 20 to 29, and 1 individual under the age of 19. In Zone 2, which is the St. John region, there is 1 new case, an individual aged 30 to 39. At this time, we have 43 active cases in the province, and as of 10 o'clock this morning, from our most recent report, there is currently no one in hospital. We are also dealing with another outbreak in an adult residential facility in the province. Our prompt team is now on site at the Résidence Oasis in Dieppe, where 1 case of COVID-19 has been confirmed. Contact tracing is underway and measures are being taken to limit any further spread among residents and staff at this facility. The situation in Zone 1 has been steadily worsening in the recent days. We have seen the number of new cases double in the past week. We currently have 8.4 cases per 100,000 people in that area, twice the rate for the province as a whole. By Zone 1, moving to the orange phase now, we hope to quickly reverse this trend. When this zone was moved to orange earlier this fall, the public's cooperation in following public health guidance enabled us to remove those restrictions after 14 days. With the same spirit of determination this time, I'm confident we will again be able to slow the spread and return this area to the yellow phase with the rest of the province. As I have said before, the COVID-19 virus cannot move by itself. It moves when people move. And it has become plainly evident that travel outside the Atlantic bubble is a major factor in the spread of COVID-19 in New Brunswick and will continue to be the case throughout the pandemic. I understand that our economy depends upon the mobility of the labor force. Some of our health service delivery depends on the mobility of the labor force. Many New Brunswickers have to travel for work to other provinces, and jobs that put food on the table for many New Brunswickers depend on that. We need to balance the needs of the economy with the protection of our population. We need to balance keeping schools open, our mental health, making sure we don't overwhelm our healthcare system. In the summer, when case numbers were low, we reduced the self-isolation rules for people traveling outside the province for work. But as case numbers elsewhere in Canada have begun to climb, we have brought in new measures to slow the spread of the illness. We have observed that workers returning to the province frequently get a negative test result when tested immediately upon return, but then test positive a few days later. And in that interval, in that time span, they may have had contact with others without knowing they have COVID-19. So workers returning from outside the province will now be required to self-isolate for 14 days or until they have had a negative test result taken on day 5 to 7 days after their arrival. If their stay in the province is longer than 9 days, they must take 2 tests, one between 5 to 7 days, and remain isolated until they have had a negative test result. It's very important that the self-isolation is completely followed, and there is information on the website on how to do that safely. A second test will be required 10 to 12 days after arrival, and if that's negative, the person will not be required to self-isolate. Les travailleurs qui reviennent de l'extérieur de la province devront désormais s'isoler jusqu'à ce qu'ils aient reçu un résultat négatif à un test de dépistage effectué de 5 à 7 jours après leur arrivée au Nouveau-Brunswick. S'ils demeurent dans la province pendant plus de 9 jours, ils doivent subir un test de dépistage entre le 5e et le 7e jour après leur arrivée et demeurer en isolement jusqu'à ce qu'ils aient reçu un résultat négatif à un test effectué de 10 à 12 jours après leur arrivée. This will ensure we reduce the number of false negatives and prevent travelers from being in contact while they are most infectious. And I will remind you that everyone has to follow these rules when they're traveling, not only those traveling for work. All non-essential travel remains subject to the 14-day self-isolation rules that have been in effect for several months. These actions are based on our learnings about COVID-19 with our own outbreaks and our evolving understanding of how we see it spreading in our province and elsewhere. Every day, this virus teaches us hard lessons. It shows us the cost of complacency. It shows us the error of thinking that the virus can't reach us. It shows us that we need to work together every day to keep COVID-19 from spreading across our province. I think what people really misguess and make assumptions about is that if you don't hear about cases in your own community, then it's not there. By the time you find out, it is already there. And I don't know how many times I have said it, but I will continue to say it. You have to act like you have COVID-19 and that the people that you are interacting with have COVID-19 all the time. Le temps des fêtes approche à grands pas et nous voulons tous passer le temps en famille et avec nos amis. Cette année, nous devons faire les choses différemment. Nous devons tous réduire le nombre de contacts étroits, soit le nombre de personnes avec qui nous passons du temps sans porter de masque et sans respecter les consignes de distanciation physique. This should be primarily those in your immediate household and as few as possible beyond that. My counterparts across the country are imploring people right now to limit their number of close contacts. In places like British Columbia and Ontario, they are referring to it as your safe six. So this is how we are going to do this. We're going to limit our close contacts. That's the best way to slow the spread of COVID-19. So here's a suggestion. Take a few minutes each day to write down the names of those with whom you are in close contact. This number will surprise you. When contact tracers are contacting people who have come into close contact with somebody with COVID-19, they say things like, I haven't been anywhere, I haven't been out very much, I haven't seen very many people. But when they actually write down the list and the names, it is astounding. It can be upwards of 30 to 40 people. So we're hoping that we can whittle that down for most people in New Brunswick right now, and that is the best way for the entire province to stay in the yellow phase. Unfortunately for the Zone 1, they are going into the orange phase, and they will have to limit their interactions with their household bubble. Everyone should aim to have this list be no longer than 6 people, your safe 6, the same 6 people. So knowing your contacts will help reduce the opportunity for uncontrolled spread of the disease. As I have mentioned, once it's in your community, it's a bit late to start making these changes because once it's in your community, it's been there for a few days, if not longer. We also have to protect our Atlantic bubble, and that means avoiding non-essential travel in and out of the Atlantic region in the weeks ahead. Nova Scotia has gone as far as saying that they don't want students traveling in and out over the Christmas break. They have gone so far in PEI to say, please don't go to Moncton to shop, please don't go to Halifax to shop where there's community spread. Sadly, this is not the year to visit family members outside the region or invite them to come here. And this sounds harsh, and I fully understand that. But the alternative is more COVID-19 cases like what we are seeing in other provinces in this country and all around the world. Overwhelmed hospitals and healthcare workers, more sickness and death, and potentially another province-wide lockdown. No one wants these things to happen. COVID-19 spreads so very, very quickly, but it spreads with each individual who is making decisions every single day as to whether to wear a mask, whether to go out of their household to do things that are non-essential, whether they're interacting with people in groups or not, and whether or not their close contact numbers are low, whether or not they're getting tested, even if they have mild symptoms. So let's keep working together. We are facing a long and difficult winter. Now is the time to think about getting outside as much as you possibly can, whatever winter activities you can participate in outdoors. We have hope. We are looking forward to when the vaccine is available for all New Brunswickers, but we know that's going to be a lengthy process in 2021, but that is what we're looking forward to. That is our goal. Make it to that time frame with everybody working together. We must not falter with the finish line in sight. Please reduce your number of close contacts right now. When you are with others outside your home, wear a mask and maintain 2 meters of physical distance. Wash your hands and follow other public health directions. All around the world, lockdowns are happening. and it is heartbreaking to see. But it doesn't have to happen here if we work together and stay strong. Thank you. Merci.
Bonjour, good afternoon. In recent days, we have once again seen an increase in number of cases in our province, particularly in Zone 1, the Moncton region. When we look at what's happening around us, the rise here in New Brunswick isn't surprising news. Le nombre de cas que nous avons au Nouveau-Brunswick est petit comparativement aux autres provinces. Mais le COVID-19 ne va pas disparaître du jour au lendemain. Cela nous rappelle que nous devrons continuer à être vigilants pour nous assurer que le nombre de cas demeure sous contrôle et facile à gérer. We have heard positive news about progress with a vaccine, but we do not expect a vaccine to be widely available until next year. In the meantime, we need to be buying time. We need to keep our outbreaks under control and secure our bubble. As Dr. Russell said, we are so close. We are within 100 days or less, or maybe slightly more, but we are so close. We see every day news around a vaccine. We cannot lose focus now. We've brought attention to our entire province. People are looking at New Brunswick for the first time, for the great attention and willpower and conviction that every resident here has shown in keeping our province safe. Our time is not to relax those efforts. After meeting with the All-Party Cabinet Committee on COVID-19 and with Cabinet, we have made the decision to move Zone 1 back to the orange level, effective at midnight tonight. Based on the advice of Public Health, we have made some changes to all 3 levels of recovery. These changes will apply to Zone 1 as well as any zone in the future that moves to the orange level. Dans le cadre de la phase orange, la porte de masque sera obligatoire dans tous les espaces publics, intérieurs et extérieurs. People must stay within a single household bubble, which can be extended to caretakers or immediate family members requiring support. We are seeing increased numbers of cases amongst younger age groups. We're hearing of gatherings, of parties, of events. Age groups often in their 20s to 29 range. That's what we're seeing across the country. We're seeing kind of a relaxation of the rules for this age group. Often these cases are covering from gatherings such as household with friends and extended family. C'est pourquoi il est important que tous les résidents de la zone 1 demeurent dans leur bulle d'un ménage autant que possible, jusqu'à que nous puissions continuer la propagation du virus. No informal indoor gatherings outside the single household bubble are permitted. However, formal gatherings of up to 25 people are allowed for weddings, funerals, and faith-based services with an operational plan in place. Restaurants, dining rooms will be permitted to remain open. However, a single household bubble must be maintained while dining out. Personal services, such as hairstylists, as well as non-regulated health professionals, may remain open as long as they have an operational plan outlining enhanced measures, such as active screening of patrons, closed waiting rooms, and enhanced barriers. Les lieux de divertissement peuvent demeurer ouverts, tant et aussi longtemps qu'ils mènent leur activité de manière sécuritaire et qu'ils respectent leur operational plan. Ils doivent limiter le nombre d'occupants à 50 personnes, s'assurer de maintenir une distance physique d'au moins 2 mètres entre les gens et garder un registre des visiteurs. Les espaces publics, comme les bibliothèques, peuvent aussi demeurer ouverts si la distance de 2 mètres est maintenue. Venues such as gyms are allowed to stay open as long as they are operating safely as per their operational plan, with additional mitigation strategies, such as 2 meters of distance. for low-intensity fitness classes like yoga, and 3 meters for high-intensity activities like spin classes. Fitness centers must have active screening measures in place. Keep a record of patrons and close locker rooms and other common areas. Sports teams must limit their activities to practice within a single team. Faith venues may hold in-person services with up to 50 participants as long as 2 meters of distancing is maintained and everyone wears a mask. However, no singing is permitted. Les services de transport en commun peuvent rester ouverts, mais les passagers doivent se tenir à une distance d'au moins 1 mètre, et ils doivent aussi porter un masque. The rest of the province, outside of Zone 1, remains in the yellow level. But we are also introducing a few changes to this level based on the advice of public health. Informal indoor gatherings of up to 20 people are permitted, and close contact should be small, limited to a consistent list of family and friends. It is important that we all make an effort to limit our number of close contacts as much as possible. We have seen several cases in New Brunswick where people tested positive and had more than 30 close contacts. And to the recommendation of Dr. Russell, keeping a record of your contacts can surprise you of just how many you have in a short period of time. Cela augmente le risque de transmission communautaire. Il devient alors plus difficile de trouver toutes les personnes qui peuvent avoir été exposées et de s'assurer qu'elles sont auto-isolées si cela est nécessaire. Under the new yellow level guidelines, sport teams can continue to play following their operational plan, and tournaments or larger events may be permitted subject to the approval of the plan. Faith venues can continue to stay open as long as 1 meter of distance is maintained and everyone is wearing a mask. However, masks must be worn and 2 meters of distance must be in place for singing to be permitted. Otherwise, no singing is allowed. When using public transportation, the continuous use of a mask is required, and passengers should ensure space is available for people who will require 2 meters of distancing for medical reasons, such as those who are immunocompromised. No matter which level a zone is in, businesses, employers, and organizations must ensure employees wear a mask in common areas and when they cannot maintain 2 meters of distance. Masks are mandatory at staff meetings and in staff rooms, and they are mandatory for all patrons and visitors. Les entreprises peuvent aider à limiter les contacts entre les employés en respectant les corps de travail assignés, lorsque c'est possible. Dans le cas de la phase orange, les employés devraient éviter d'utiliser les espaces communs lors des pauses et des repas. Pour les régions qui sont dans la phase jaune, les employés devraient limiter leurs contacts lors des pauses et maintenir une distance physique de 2 mètres. Employers should also ensure their ventilation system servicing is up to date and check their airflows. Non-essential travel in and out of an orange zone should be limited. People living in an orange zone are asked to avoid any non-essential travel to other zones. However, New Brunswickers can continue to travel within the province for work, school, essential errands, and medical appointments. As Dr. Russell explained, we are also introducing important changes to the testing and isolation guidelines for New Brunswick workers returning to the province after working outside of the Atlantic bubble. This month alone, under the previous guidelines, more than 60% of the workers following modified self-isolation rules who tested negative on day 1 later tested positive between days 5 to 7. Between those tests, they were able to move freely through the community, which has put us all at greater risk of coming into contact with COVID-19. en vertu des nouvelles lignes directrices. Nous allons permettre aux travailleurs de Nouveau-Brunswick de profiter de leur court séjour dans leur province d'origine, tout en limitant la propagation du virus de manière plus efficace. Ces règles peuvent sembler strictes, mais quand nous regardons ce qui se passe dans les autres provinces, nous devons mettre en place ces mesures de précaution. In Alberta, for example, there are more than 10,000 active cases right now. If the equivalent situation happened in New Brunswick, accounting for the size of our population, we would have more than 1,700 cases, and our healthcare system would be overwhelmed. We have to do everything we can to ensure New Brunswickers aren't exposed to this high level of risk. Il y a eu de petites augmentations du nombre de cas dans les provinces de l'Atlantique, mais dans l'ensemble, la boule atlantique demeure intacte. Tout le monde a la responsabilité de fournir sa part d'effort pour que cette situation ne change pas. We still have an enviable situation here in New Brunswick and in all of Atlantic Canada. We've achieved this by working together, and we can continue this by working together. I know it's not easy. Universities are back. Social lifestyles are demanding changes. We just need to be diligent. For a few more months, let the vaccine have time to arrive. Let's keep this together. We are the envy of our country. We're the envy of other countries. Let's not lose it with being irresponsible at this point. Let's make sure we arrive safely when the vaccine arrives and everyone arrives with us. Thank you. Merci.
Thank you, Premier. Before we proceed, can everybody please mute your microphones? Merci, thank you. We'll now proceed with questions from the members of the media. Each reporter will have one question today. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser votre question dans la langue de votre choix. Chaque journaliste peut poser une question. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier. Premier Higgs, with cases continuing to rise in Washington County, Maine, the seasonal ferry to Campobello ending on December 1st and already not running on days like today and yesterday when there's high wind, Campobello Islanders are concerned about how this will impact their lives this winter. Many Islanders are already reporting being denied services from dentist appointments to eye exams on the mainland after screening reveals they've traveled to the U.S. Are you reconsidering working to secure a year-round ferry to Campobello? And is it okay for mainland businesses to deny services to Islanders who travel through the U.S.?
So firstly, we don't want any services to be denied for residents of Campobello Island when they're trying to get those services here in the province. So I am very interested to understand any case where that is happening. We have gone through great effort to ensure that the border crossings, the officials there understand the significance of residents of Campobello being able to come back and forth as they always did. And also the residents recognizing that stopping in Maine is a risk, and so we're asking to drive straight through in both ways back and forth. So I want to understand those cases, and we've asked for any contacts, to connect with the local MI, connect on our COVID website, but make us be well aware, because we will deal directly with that. We know that going into winter season, the ferry operation will be unreliable. Extending the operation is not likely the solution because of going into winter. But I want to know if there are cases that are not being allowed and services are not being provided, because that is unacceptable.
Thank you, Premier. Thank you, Ms. Hogarth. Travis Fortnum, Global News.
Hi there. My question is for Dr. Russell. A bar in St. John is notifying people people through social media that there was possible COVID-19 exposure there this past weekend. They say they're working with public health and following their advice. I'm wondering if you can confirm the details that they provided.
Okay, Travis, before we start, everybody please mute your mic. We can hear someone typing on their keyboard and it's very frustrating for your fellow colleagues. Thank you. Dr. Russell?
So I can't comment on specific cases or situations. All I can tell you in a general sense is that if public health is aware of public exposures because of contact tracing, et cetera, public health makes a public announcement about public exposures. Individuals who have COVID-19 are contacted individually. Their close contacts are contacted individually. If there is a workplace or an institution, an organization, a business involved, communication would happen directly with that business or with that organization directly from public health. So I can only comment on situations that I'm aware of where there's a public exposure, and then public health will be announcing that to the public.
Thank you, Doctor. Thank you, Mr. Fordham. Sarah Seeley, Times and Transcript.
So my question is for Dr. Russell. I was wondering if cases continue to work in Zone 1, if masks will be made mandatory in gyms and fitness facilities while workouts are underway.
I couldn't hear you. Can you repeat the question, please?
Sarah, can you repeat it, please?
Sure. I was wondering if cases continue to worsen in the Zone 1 region, if mandatory masks will be made possible in fitness facilities while workouts are underway, rather than just in common areas.
Well, gyms will be open in the orange phase in Zone 1, but they have to have an operational plan, et cetera, and we have more details on gyms in the information that we're putting on the website, and if it becomes necessary to go that route, that would be another discussion that we would have later.
Thank you, Doctor.
Thank you.
Thank you, Ms. Seeley. Laura Lyle, CTV News.
Hi, thank you. This question would be either for Dr. Russell or Premier Higgs. I'm just looking for a little bit of clarity on the close contact information. There was advice about having a safe sex through the holidays, as well about informal indoor gatherings of up to 20 people. I've noticed comments just as I'm tweeting, just a little confusion about that. So I'm just looking for a little bit of clarity as to how, I guess, how many contacts we should be close with.
Well, in terms of what we would be enforcing, it would be the 20, but I am suggesting to go even lower than that. This virus is spreading like wildfire across the country. It's spreading in the U.S., record number of cases every day, record numbers of deaths globally every day, lockdowns in the UK and Europe. So I would suggest that everybody take stock of how many close contacts they have, write them down, make a list, and in places like BC and Ontario, they're suggesting 6 consistent people separate from your household. So that is what we are suggesting.
Thank you, Ms. Lyle. Thank you, Dr. Liam Floyd, The Huddle. Liam Floyd. Mathieu Roy-Como, l'Acadie Nouvelle.
Bonjour, Madame Russell. Dr. Russell, pouvez-vous nous en dire un peu plus sur ce qui se passe en ce moment à la résidence Oasis, où vous avez parlé d'une éclosion, les mesures qui sont prises et puis la situation là-bas?
Alors, pour moi, l'information que j'ai reçue, c'est qu'il y a un cas. Et quand il y a un cas dans un établissement comme cela, on a un processus qu'on emploie. C'est le même processus qu'on a eu avec la manoir de la vallée, etc. Alors, c'est l'équipe qui va faire le dépistage. Et il y a 63 résidents, je crois, et 34 staff, puis ils vont être toutes testées aujourd'hui avec le test rapide. Puis ça va continuer. Ils vont être testés chaque couple de jours pour faire certain qu'il n'y aura pas des cas qui sont dans la résidence.
Monsieur Comont, Marie Sutherland, CBC.
Good afternoon. My question's for Dr. Russell. You spoke about the tighter rules for people traveling for work. We're hearing about inconsistent advice from public health about whether all people need to isolate while they wait for their COVID test results. I'm just wondering, can you please clarify what the rules are?
Yes, so in the summer, when we relaxed the rules about self-isolation, it was really targeted at workers who would go away for 2 weeks and then come back. And when they were away for those 2 weeks, they would be work isolating. They would not be allowed to do anything but go to and from work. And then when they would come back to the province, then they would have to self-isolate for 14 days and not be with their family, and then they'd have to go back again. So it was quite damaging from a mental health perspective. So because the case numbers were low in the summer, we allowed a relaxed protocol around that type of traveler and that type of worker. In the meantime, the risks have gone up all over Canada and elsewhere in the US and globally. So we changed the protocols so that people would be tested on day 1, and then they wouldn't have to self-isolate, but they'd still have to be tested on day 5 to 7, and then again on day 10 or so, 10 to 12, if they were going to be in the province for longer than 14 days. What we have noticed with the data that we've collected and what we've seen with cases connected with travelers in that particular scenario is that people would test negative on day 1, and then by day 5 they tested positive, and by then they had been interacting with close contacts and would have transmitted COVID that way in that time frame. So now everybody who's traveling for work has to self-isolate for that first 5 days until they get tested and get that result, and then they don't have to self-isolate after that, but they still will have to get tested on between day 10 and 12 as well. So we are requiring them to, it's a change from what we were talking about before in terms of work isolation. This is actual self-isolation. So that has to be away from their family. In other jurisdictions, they are really requiring that either the whole family isolate together, which we actually have in our mandatory order with respect to if you don't have a self-isolation plan that is safe and executable in your home in terms of not having to share bathrooms, et cetera, then you could self-isolate in your household. But if you can't really guarantee that you're not going to be interacting because of not being able to have enough space, then your household would have to isolate with you.
Thank you, Doctor. Thank you, Ms. Sutherland. Erica Butler, CHMA, Sackville.
Hi, thank you. So between Tuesday and Wednesday, the stats on the province's COVID dashboard under case origin changed the number of community transmission cases from 13 to 14. Can you give any further information about that case, such as what zone it was in? And I'm just wondering why that information was not included in the daily update.
So with respect to all of the cases that are active currently, they're either travel-related or close contacts of travelers. There are a few cases that are still under investigation, so we haven't declared them as being community transmission. So, and I haven't seen that part of the dashboard in terms of what that number shows. But what we are aware of is that people do want to know what the pattern has been. So I did ask our team looked at it from an epidemiological perspective, and in November we had over 70% of travel-related self-isolation exempt cases, and then there was no self-isolation due to the federal exemption. And some of those had over 30 contacts, and of those who were under modified isolation, over 60% had a negative day 1 test and then later tested positive during the day 5 to 7 test. And in between day 1 and the day 5 test, there was no isolation. And so what we're talking about in terms of border measures and isolation is the situation around the travel that we're seeing when it's work-related. There is another set of travelers, obviously, that are traveling for reasons other than work, but all of the cases up until now are either travel-related or they are close contacts of travelers, and the rest are pretty much still under investigation. In our outbreak in Zone 5, it took almost 4 weeks to establish links to the cases. There were, at least at one point, there were 5 unlinked chains of transmission, and by the end of the outbreak, by week 4, after interviewing people several times, they were finally able to make those links. But what we know now is in Halifax, there is community transmission and community spread. We are calling this a community outbreak. So there is different parts of the community that are affected in terms of exposures and the way that the virus is transmitting in Zone 1. So in terms of active cases, we have 43 active cases in the province right now. 24 of them are in Zone 1, 7 in Zone 2, 9 in Zone 3, and 2 in Zone 6, and 1 in Zone 7.
Thank you, Ms. Butler. Thank you, Doctor. François Leblanc, Radio-Canada.
Oui, question pour Dr. Jennifer Russell. Dr. Russell, on a appris aujourd'hui qu'il y avait un membre d'une équipe de hockey dans le sud du Nouveau-Brunswick qui avait reçu un diagnostic positif, un test positif de COVID-19. Il y a beaucoup de parents qui sont inquiets, pour dire poliment, qui sont un peu en colère du fait qu'il n'y a pas eu d'action rapide qui a été prise pour empêcher que d'autres joueurs, d'autres équipes viennent en contact avec des membres de cette équipe-là. Il y a du monde qui pose la question sur quelle est la rapidité où vous pouvez agir pour empêcher que ça se propage assez rapidement. Cette équipe-là a joué plusieurs fois contre d'autres équipes. Il y a d'autres équipes qui ont joué après, qui auraient pu rentrer en contact avec eux autres. Donc, si vous pouviez commenter à ce sujet-là, vous expliquer quel est le processus et comment ça fonctionne.
Oui, j'aimerais que les parents sachent que aussitôt qu'il y a un cas positif, les contacts étroits sont contactés par la santé publique et comme c'est des équipes de hockey ou d'équipes de n'importe quoi, on a une liste qui est fournie avec les plans opérationnels des différents genres de sports, n'importe quelle situation. Alors, si les parents ont des inquiétudes, si leur enfant a été en contact avec quelqu'un qui est positif, la santé publique va les contacter directement. Alors, s'ils n'ont pas reçu un appel de la santé publique, c'est un processus qui se fait entre 24 heures après le cas a été testé positif. Alors, pour les inquiétudes, je peux seulement dire que s'il y a des contacts étroits parmi les équipes, eux, ils vont être contactés par les départements de santé publique, les infirmières, et ils vont être dirigés isolés à la maison. Alors, c'est ça. Après que la personne est testée positive, les contacts étroits sont contactés immédiatement.
Merci, M. Leblanc. Merci, Docteur. Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, you referred to wanting to reduce the number of cases from traveling workers. How many cases were missed, and are these the problem in Zone 1?
Well, they aren't the only thing that is contributing to the increased number of cases, but they are contributing. So all cases are imported at this point in time. In terms of how COVID gets into New Brunswick. So that's not going to change throughout the pandemic because we have been successful at containing outbreaks and then being able to declare them over, and then the zone that's involved goes back to the yellow phase. So we are going to see this continuously throughout the pandemic. So we know that travel-related cases, whether it's from workers or other people, can infect people after they return back to New Brunswick from outside the Atlantic bubble. So we know that can happen. Again, if it's a worker who is self-isolating at this point in time, because we've changed the rules, we're going to pick up those cases on day 5 to 7 when they get tested. They will be self-isolating throughout that time period. Because we weren't, prior to the testing strategy that started to test travelers, workers, they didn't have to self-isolate at all. And so there were much, much higher risks before. And as we see the number of cases go up around the country, these risks are becoming very, very high. So in order to manage those risks, that's why the testing was implemented. So in November, in the month of November, we have had over 60% of the travel-related, the people who were exempt from self-isolation, meaning they'd had no self-isolation due to the federal exemption. And I'm just saying, of those, some of them had close contacts of up to 30 people. That doesn't mean that every single one of those people is going to test positive, but certainly that means that they're all self-isolating at home now as a result. And then there was about 60% of the people who ended up getting tested, they tested negative on day 1, and then on day 5 they tested positive. So there is a 60% of those people who had modified self-isolation. There would have been a period of time when they were contagious and able to transmit COVID during that time. So we are seeing some cases as a result of that, and that's why we are changing the testing to make sure that people are tested, have to self-isolate until they get that day 5 test. What we also know in terms of the transmission patterns, and again, we analyzed this in Zone 5 at the time, so we could really communicate very, very specifically and clearly with the population so they understood this is how the transmission is happening, this is what the population needs to do to address that. So the other places, as the Premier has mentioned, we are seeing links to recreational events, sporting events, gatherings. In Zone 5, there were a lot of family connections, so people were gathering in homes. Sometimes it was employees and colleagues gathering outside of work. Sometimes it was on breaks at work. But now we're seeing transmission with respect to sports teams and gatherings. And so we really, really need people to limit their number of close contacts at this point in time to limit the spread.
Thank you, Ms. McKinnon. Thank you, Dr. Tom Bateman, Times and Transcript.
Oh, hi there. For Dr. Russell, if I heard you right, I believe you said that this year is not the year to visit family members outside of the region or for them to visit you for Christmas this year. What do you mean by region? Do you mean health region, like zone 1, 2, 3, 4, and 5? Do you mean the province? Do you mean outside of the bubble? And do you anticipate making more firm recommendations? People are kind of confused by that.
So what I'm trying to echo is the same sentiment and recommendation that is happening in Newfoundland, PEI, and Nova Scotia. The Atlantic bubble is fragile, and that is not a surprise, that is not new. To protect the Atlantic bubble in terms of travel-related cases, we have to continue to limit non-essential travel. We've done a great job. We've decreased our travel by 80%. That's a significant amount, and we'd like it to keep it that way, and we know that the holiday season is a time that people want to travel to see their loved ones, and what the entire Atlantic bubble, all of the leaders are saying, please don't do that. We really, really want to limit people traveling out of the Atlantic bubble because then when they come back, again, the risk of bringing COVID-19 with them is there. And we really have a really hard time of making sure that we can keep it under control once outbreaks start because they can go so quickly. And again, looking at what's happening in the rest of the country, being overwhelmed, you know, back in the summer, if people had a desire to travel, we weren't necessarily discouraging them. They could go away and come back and do their self-isolation. But that was before the record number of daily cases was being recorded in most every province in this country. And several provinces are wanting to go into lockdown. Many provinces healthcare systems are overwhelmed, and the chief medical officers of health in those provinces are imploring people to limit your close contact numbers and try to get things under control, and don't travel for any non-essential reasons. Don't go anywhere for any non-essential reason. So all of the Atlantic provinces, again, would like to protect the integrity of the Atlantic bubble. It is fragile. We all have a limited number of resources, and we want to protect our healthcare system. We want to protect our economy. We want to keep our schools open. So we have a lot to lose, and so that is why we are sending this message in terms of our recommendations and our suggestions at this point in time.
Thank you, Tom. Tori Weldon, CBC.
Hello, this question is for Dr. Russell. It's basically Francois's question, but if I can just get the answer in English, having to do with when it comes to contact tracing with kids at sports. And I guess I would also like to know how long it takes to do that sort of thing. So the process and then the length of time expected to take.
Well, in a general sense, contact tracing is done within 24 hours. So as soon as somebody's diagnosed as positive, they are contacted, and all of their close contacts are directly contacted by public health.
Thank you, Ms. Weldon. Sophie Desautels, Radio-Canada.
Oh, I'm sorry,
Bonjour.
could you, sorry, your answer to Francois, what you said in French there, would you just be able to repeat it in English, just what the process is? Would you be able to do that?
That was for the hockey team. Can you repeat it in English, what you said in French?
Whether it's a hockey team or a soccer team or a business or a school or an institution or an adult residential facility, et cetera, all of the contact tracing for a positive case occurs the same way. As soon as we get the results of a positive COVID-19 case, we contact that individual. We get the list of contacts, close contacts and phone numbers, and we contact those people within 24 hours, and they are all then directed to self-isolate immediately. If any of them have symptoms, they would be encouraged to get tested at that time. If there is a notification between a business or an organization or institution, that does happen directly from public health to that organization. And the only time that public health will put out any kind of a public exposure notification is if there has been an exposure in a public setting that we are worried about, where we weren't confident that we would have been able to reach any type of close contacts that would have been exposed in that type of setting.
Thank you. Thank you, Tori. Sophie Desautels.
Oui, bonjour. Ma question est pour le Dr. Russell. Vous avez parlé d'un cas à la résidence pour personnes âgées Oasis. Nous avons la confirmation qu'il y a un cas dans une garderie éducative d'une école de Moncton, l'école Sainte-Thérèse. Est-ce que vous pouvez confirmer ce cas positif et pour quelle raison vous n'en avez pas parlé?
Merci pour la question. On a un cas qui est confirmé dans une garderie. Puis tous les gens qui sont impliqués ont été contactés personnellement, individuellement.
Merci, Sophie. Marie-Ève Brassard, Radio-Canada.
Oui, c'est que j'ai pas eu la réponse. C'est Sophie Desautels à nouveau. Je vous ai demandé pourquoi vous n'en avez pas parlé de ce cas dans cette garderie.
Il n'y avait pas vraiment
Everybody got their letters, so there's no public exposure.
OK. Tous les gens qui sont impliqués ont reçu une lettre de la santé publique, alors il n'y a pas un risque dans la publique.
Marie-Ève Brassard.
Oui, bonjour. Ma question est pour Dr. Russell. En fait, Dr. Russell, j'aimerais premièrement savoir si c'est possible que lorsque la santé publique contacte un commerce qui a été fréquenté par quelqu'un qui a été déclaré positif à la COVID-19, qu'on recommande dans un cas à un commerce de fermer pendant 24 heures et pour un autre commerce qu'on ne recommande pas du tout la fermeture. Est-ce que c'est normal?
Les situations sont individuelles, comme les inspecteurs des restaurants, quand ils vont à faire une inspection pour dire qu'il y a de quoi qui devrait être géré, réglé comme tel. C'est des directions très spécifiques pour chaque situation. Alors, je ne peux pas vraiment commenter sur la différence entre des situations. Chaque situation est différente.
Merci, Marie-Ève. Geneviève Normand, Radio-Canada.
Yes, thanks for taking my question. It's actually for Premier Higgs. I'm hearing, Premier, that I want to go back to actually Vicky's question, that Campobello residents are being told, as of today anyway, that they need to self-isolate for 14 days if they want to obtain essentials in Maine, like fill up their car. Do you think that makes sense? And if so, what are you going to do?
Well, we have encouraged them not to stop in Maine and not to, to have groceries or to actually fill up their car if they can avoid that, and if they're transiting to come straight through into St. Stephen. However, we have allowed them to do that and then come back into Campobello. So that is those are the current rules. So if they're being forced to isolate, then I said earlier, I want to know what those cases are, because we have to allow the residents to proceed as normal. But we are saying, normal should be in this COVID world, given the situation in Maine, it should be traveling right through and back into New Brunswick.
Merci, Geneviève. Harry Forrestal, CBC.
So thank you for taking my call. When I spoke with you yesterday, Dr. Russell, we talked about the situation of the spread and its involvement of young people. You said we do still see people who are going to workplaces with symptoms, who are not staying home when they're ill and not getting tested when they're ill. And this is what we saw in the outbreaks in Zone 5 and 1 a few weeks ago. We are seeing the number of cases in young people. We're also seeing that in Nova Scotia. And many of the cases are young people aged 20 to 35. Could you explain how big a factor that age range is currently in the spread of COVID-19?
Well, certainly when you look at the outbreak in Zone 5 previously, it was a combination of 3 different things that were contributing to the spread, including people not getting tested when they have mild symptoms, people not wearing their masks when they were working with their colleagues in non-public facing areas or on breaks, and then also the large number of close contacts. So what we're seeing in this Zone 1 outbreak at this time, same drivers in terms of large numbers of close contacts. It happens to be in a younger age group. And the other thing is still we're seeing people that have mild symptoms who are not getting tested and still going out and about and interacting with people and having close contact with people, whether in a workplace or socially. And again, we're seeing the travel-related, work travel-related pieces of this, and we're addressing that with the testing, the changes in the testing strategy right now.
Has the news of the imminent availability of viable vaccines worked to undermine the efforts that your office is trying to make?
Sorry, Harry, can you repeat that?
Has the news of the imminent availability of viable vaccines undermined the discipline that we've had in this province so far?
I would hope not. I can't imagine that it would. I think some people might attribute the perhaps complacency or perhaps not understanding the increased risks. I feel like people don't understand that the travel-related cases, whether it's for workers, essential travelers, or otherwise, that is how COVID-19 will get here. Is there a risk of community transmission from elsewhere inside the bubble? Well, in Halifax right now, they have community transmission. So I wouldn't say that the vaccine is undermining. I think the vaccine gives people hope, but I hope it helps people be energized and rejuvenated in terms of their renewed efforts, in terms of being very vigilant right now as we see globally and nationally numbers of cases increase. I am going to come back to the question about masks in gyms, and requiring mask use in gyms will need to be part of an enhanced operational plan in order to stay open in the orange phase. So that question came up earlier around gyms being allowed to be open in orange, but it will be part of the enhanced operational plan in order to stay open in that orange phase. But thanks for your question, Harry. Again, I feel like the vaccine is something that provides hope to people. We know that the rollout will be very different based on different priorities in the province, but also across the country. And we know that it will take a long time because there are different types of vaccines, and when the rollout of that could take up to a year.
That concludes today's update. Cela conclut la séance d'aujourd'hui. Merci beaucoup. Thank you very much.